Colleagues, let's move on to the next presentation. And this is by Dr. Misheck Mulumba, and he's going to share the African perspectives on One Health. So Dr. Misheck Mulumba serves as the chair of the steering committee of AFONET. His full-time job is as head of the Agricultural Research Council on the Spot Veterinary Research Institute in South Africa. He's also a member of the OIE Scientific Commission and the ad hoc advisory group on COVID-19. He is also a very active and important member and co-chair of the South African One Health Forum and One Health Steering Committee. So welcome, Dr. Mulumba. The floor is yours.
Thank you. And can you see my slide?
Yes,
my screen?
Can.
Okay. So I'm going to try and give an African perspective on One Health. And this is very important, colleagues, because we do not all look at One Health in the same lens, especially if you look at the Northern Hemisphere and the Southern Hemisphere. And that's why we have the need to have the correct lens when we are talking about One Health. Are my slides moving when?
Yes, it's clear, Dr. Mulumba, unless you want to try the presentation mode.
Yeah, I've put it in presentation mode, but it's not moving here.
Okay, but it's still fine. You can continue. Thank you.
Okay, so from a contextual point of view, we can look at One Health from a global context and also from an African context. Globally, the definition of One Health is currently dominated and driven by the developed North. And in the developed North, we see that they live in a largely disease-secured environment. And that is why the focus there is on emerging or re-emerging diseases. And these are characterized by quick reaction times when they have an incursion of emerging or re-emerging diseases. But what about the continent, the African continent? We, to some extent, share the same concerns as the North, but we have a little bit much more on our plate. For example, we have to deal with neglected diseases like human African trypanosomosis. We have to deal with brucellosis. We have to deal with tuberculosis, which are largely absent in the Northern Hemisphere. Then we have to deal with Ebola and other hemorrhagic fevers. And another important difference is that we are at different levels of implementation of One Health. And this is characterized by a delayed response when we have emerging or re-emerging diseases. A case in point was COVID. So COVID highlighted the disparities in response time and effectiveness between the developed North and the South, and also even in vaccine administration and uptake. So we feel that One Health should be the entry point for addressing public health, vaccines, and other policy issues that we have to deal with. If we look at the cohesiveness, or rather the lack thereof, of past One Health interventions on the continent, we'll see that these have largely been segmented by discipline and by region. That's why you have AfroHUN, which is the African Universities One Health Network. Then you have national One Health initiatives like we have in South Africa. You have some One Health research networks, which are principally focused on research only. And this really, after we took stock, led us to the conclusion that Africa has a lot of One Health capacity. Unfortunately, this has not been translated into One Health capability. Why? Because so far it has been academically focused and responsive. So the challenge then is, how do we go down to the community with our One Health initiatives? So currently, One Health is characterized by a disconnect between academic knowledge, what we know, and policy formulation, what we take to the policymakers to formulate into national or international policies, and the implementation part. Just a good question is, if today you went on the streets of Pretoria or Johannesburg and they started talking to passers-by and asked them what One Health is, chances are that most of them won't know what it is, and you probably get as many different answers as the people you can talk to. So AFONET was over and above, supporting research, principally formed for this purpose. So we want to work together with other stakeholders, like the donors like DITRA, Africa CDC, then you have other partners like AU, IBA, WHO, WOA, FAO, towards a realization of cascading down One Health to the level where it is universally understood by everyone to mean the same thing. So just a slide on AFONET, which is the Africa One Health Network. It was formed at a congress which was held here in South Africa in Johannesburg in 2019. And it was attended by One Health experts and practitioners from health, agriculture, and environment from across the whole continent. There is a steering committee, and we also have a subcommittee on networking and resource center, which is comprised of representation from across the whole continent. We have generated a lot of interest, not only continentally, but also internationally, to the extent that we are actually the co-chair of this year's World One Health Congress, which will be held in South Africa in September. And the main activities of AFONET are organizing our Congress meetings, and we are looking at organizing One Health Forum meetings, which will link academia or researchers with policymakers and implementers, and also looking at organizing right shops for emerging, One Health researchers, then coordinating and networking of continental and national One Health initiatives, as well as supporting research or researchers in continental One Health initiatives. And then we also source funding for some of our members to carry out their projects. So to accomplish all this, we realized that AFONET needed to evolve into a legal entity. And as such, we are now incorporated in Nigeria, in Abuja, with a designated address, which allows us to enter into legal contracts and transact legally with other organizations. So when we look at going forward, how do we address the One Health problem in Africa? There is a realization that we need to move from academics or research to the policymakers and implementation stages. So we need to bridge that disconnect. We need to bridge that gap so that we have the same priorities, so that we identify the resource needs which will be required to implement One Health activities, so that we develop and formulate appropriate One Health policies. And AFONET actually works as a catalytic, partner in most of these initiatives. And therefore, we talk to funders like the Bill and Melinda Gates Foundation, the EU, the African Development Bank, the World Bank. All of these have been in contact with us. And we hope that we can link up researchers, even from South Africa, especially young researchers, so that they can have their One Health projects funded. The lessons we've learned are that without doing this effectively, One Health will just remain on the shelves as an academic exercise. So we need a mindset change on the way we look at One Health in the continent. And thankfully, the situation is changing for the better now, because a lot of countries have done pioneering work in setting up One Health structures, including South Africa itself, with the support of partners. We have examples from Rwanda, from Senegal, from Tanzania, Uganda, and South Africa, all of them looking at how they can mainstream One Health into the national activities. So what we are trying to do in AFONET is those countries which are a little bit behind or have not embarked on this yet, we link them up with the countries which are a little bit more advanced so that they can be peer learning from these other countries. So what are the lessons that we learned from COVID-19? Well, it taught us that due to the globalized and integrated world that we live in, one country cannot claim disease security when the others are not. And therefore, it is in Africa's interest that we move together on implementing the 2005 International Health Regulations, as well as the terrestrial and aquatic animal health codes. But we should do this with an Africa-centric approach, which is targeted at resolving the continent's One Health challenges. I'll give you an example. You attend many One Health meetings everywhere, And rarely are you going to hear about tuberculosis, brucellosis being One Health challenges in those countries. And it's not surprising, because if you look at the developed North, their milk consumption is up to 98 or even 99% pasteurized. That's not the same case in Africa. So such low-hanging fruits are the ones which we should seize upon so that we can make a positive impact in our continent on resolving the visible One Health challenges which the population can relate to. So what we are doing should not be considered isolationist, but instead as a specific initiative that is focused on identifying and resolving Africa's One Health challenges with the support of the global community, if possible. So to conclude, I would like to say that we strongly believe that with proper coordination and networking among African researchers, academicians, policymakers, and implementers, we'll be able to effectively and progressively address the myriad of One Health challenges that are confronted by the continent. And then working together with many partners, we believe that we'll be able to effectively translate this to the SADC subcontinent and the African continent as we work together to effectively address the One Health challenges affecting the continent. It is important to note that rather than being viewed as isolationists for this decision which we have taken to have an Africa-centric approach to One Health, AFONET works and intends to expand working closely with development partners and other stakeholders in other continents to not only better define and understand, but also to address the myriad of One Health challenges confronted by the continent. And we believe that other continents will benefit from our experience. And that's why it is no accident that we were actually chosen to be the co-host of the World One Health Congress to be held later in South Africa this year. And in conclusion, I would just like to urge all of you to visit our website, which is afonet.org. And please, you can become a member by joining online, and then you'll get an acknowledgement that your membership has been approved. Thank you very much.